With you all today. We have special guests here from Griffin Hospital. As many of you know, in November, Connie Evans came to the club and spoke to us on behalf of the new breaking ground at the Griffin Hospital Care Center that was opening. She came to us and did a little presentation in November, and we, on behalf of the club and the board, we decided to send a $10,000 check and have a naming opportunity at the new community care center, cancer center, over at the Griffin Hospital. I'm really, okay, Pat's here today, and he's going to say a few words, and then we'll be presenting him a check.
Well, thanks for inviting Connie and I, and thank you for this generous gift. Our capital campaign is really vital to the success of this important project. As you know, we're trying to raise, I'm sure Connie told you this, $5.5 million to support a very ambitious project. It really has two major components: the creation of our community cancer center and the expansion of our emergency department. And the cancer center project is in something called a Hewitt Pavilion, which is a new building on campus. It's a 50,000 square foot building that had a $17 million price tag. And then the rest of the project includes the emergency department expansion, but being a hospital that's somewhat landlocked and built now 100 years ago, we had to move an awful lot of things to make the ED expansion possible. So that part of the project is about the same cost as the cancer center construction. So it's a very ambitious project, especially in this economy. So we're getting very close to our goal. But this $10,000 gift gets us that much closer. And it really indicates the broad support, not only for the hospital, but for this project specifically. Just in terms of the cancer center, it opened in October. It's been very well received. Unfortunately, we're a little bit ahead of schedule in terms of the activity that we're seeing. There was a little bit more need for comprehensive cancer treatment services in the community than we anticipated. From a business standpoint, that's good. From a public health standpoint, it's not so good. We've already evaluated over 100 patients. We have 21 or 22 patients in active radiation therapy treatment right now. There are a number of patients that are being evaluated. So that really demonstrates how much this was needed. Each one of those patients, if it wasn't for this center, would be traveling to Bridgeport, New Haven, and Waterbury over a 6 to 8 week period for up to 40 treatments. And many patients have, especially toward the end of their treatment, they're weak, they have other underlying problems. This has always been a real burden for families in this community to seek radiation therapy outside the community. So we're really pleased that we're able to provide it locally, and I really think it's making a difference in people's lives. So you should be proud of your contribution and helping us make this possible. So I just want you to know how appreciative we are, and if you can spread the word about not only the service that's being offered so that people do take advantage of it, but also let folks know that we're not quite there yet, and whatever support that can be generated between now and then could make it possible to pick up that $500,000 grant. That's $500,000 that we certainly don't want to leave on the table. So thank you very, very much.
I'm going to trade places. Thank you. Thank you. Thank you to our Rotarians, our club. Thank you all.